Hi, I'm Tracy Bevington. I'm a licensed marriage and family therapist and the founder and owner of a group therapy practice called Pacific Marriage and Family Therapy Network. We have offices in Santa Monica, Manhattan Beach, and Sherman Oaks, and we have 20 therapists for you to choose from. Today, I want to talk a little about CBT. CBT is a kind of therapy that is very common. It's evidence-based, it's short-term, it's pretty effective. So a lot of therapists use CBT. CBT stands for Cognitive Behavioral Therapy. So as in the title suggests, we are going to be working with your cognitions or how your brain is processing whatever it is that's happening to you. So when you're working with a CBT therapist, one of the things you'll do is you'll work together to understand what the problems are and strategies to resolve them. Sounds pretty simple. It's really not that tough, but it does take some effort. One of the things that makes it a little challenging is there are often worksheets and homework that you're assigned when you're working in a style of CBT. So you may get a worksheet that asks you to track your feelings and thoughts based on some kind of a triggering event. So you could be keeping a log for one whole week, and then you're going to review that with your therapist. Another type of worksheet is it's talking about the cycle of thoughts, feelings, and behaviors. So basically, you have a triggering event, and then we have thoughts about what that event means, which then leads us to feeling a certain way. And then our body, because we're having the emotional response, is going to have a physiological response, and that leads to whatever behavior that we choose to take. And then that also leads to another event that may or may not be triggering. So this cycle is happening hundreds of times a day. And so in CBT, what we're trying to do is really break down that cycle into these different pieces and look at and become more aware of, is the thought that I'm having or the thought that I'm assigning to that event reasonable? Is it appropriate? Is it even true? Oftentimes, our reaction to an event is based on our previous experiences. And so that means that it's not necessarily true today. It may have been true way back when, but it's not necessarily true today. So one of the cornerstones of cognitive behavioral therapy and trying to re-evaluate our thoughts and feelings is to identify cognitive distortions, or these cognitions that we are applying to these certain events that are not accurate. Once you can practice experiencing the event, thinking about what's really happening and what's true, that changes how you feel about the situation. And it also changes how our body is going to respond to it. And it changes the behavior. So if someone were to experience an interaction as very negative and angry, let's just say it's the beginning of an argument in a relationship. If you go through the cycle just reacting, chances are you're going to get triggered, you're going to put lots of negative thoughts into it, which is going to make you feel horrible, which is going to make your body respond negatively. And the choice that you make based on all of that is probably not going to be the best choice. And so the argument continues. And it just keeps going and going and going because we're reacting in a way that is not helpful. So CBT is trying to break the cycle. Like I said before, it's really effective. Sometimes people like to combine CBT with other modalities so that in addition to just kind of developing these tools to stop your thoughts or to reframe or to restructure, in addition, they like to dive into, well, why is this a trigger in the first place? What makes this event so bad for you? So you'll see often CBT used with psychodynamic or other kind of processing. There are some therapists that are 100% CBT. And so it's important to ask your therapist if you're interested in using CBT in your work, to ask if they are competent in CBT or if they do something other than CBT, something more like hybrid. You can find a lot of information online. There are many books about CBT. It's pretty straightforward. So CBT is excellent for any kind of anxiety, depression, and recovery, addiction recovery. CBT is looked at in the community as almost like a cure-all. It can apply to just about anything. A lot of it, though, does depend on the quality of your therapist. So if you have a therapist that doesn't use CBT effectively, then obviously it's not going to work as well. So please make sure, if you're interested in using CBT in your therapy, that you talk to your therapist about it and really ask the questions, because there's nothing worse than going into therapy and not being happy with the results. So once again, I'm Tracy Bevington with Pacific Marriage and Family Therapy Network. And if you are interested in contacting us, you'll see a link at the top of the page. You're also very welcome to leave a comment. If you have a comment or a question about what I've discussed today, I'm very happy to respond. Thank you very much, and I hope to see you next time.